Good evening and welcome to Cook County Department of Public Health's monthly Ask the Doctor broadcast, where leading doctors from Cook County take questions directly from Cook County residents. It's hard enough to get to your doctor to keep up on the latest COVID news and developments, so the doctors are here to make virtual house calls to you. And tonight, those house calls are being made in the middle of a snowstorm. There's a lot going on concerning COVID, including the possibility that children aged 6 months through 4 years might soon be eligible for vaccinations. To help us make sense of it all, we have Dr. Kiran Joshi, the co lead and senior medical officer for the Cook County Department of Public Health. Joining Dr. Joshi is Dr. Nimmi Rajagopal, Assistant Chair of Family and Community Medicine in Cook County Department of Cook County Health, and your host today, Deidre Reese, Regional Health Officer, Cook County Department of Public Health. As we get started, just wanted to set aside the ground rules. If you have a question, we ask you that you leave it in the comments and we will try to get to each question. Please know that if anyone insults anyone else, posts misinformation, offensive language, or other negative comments and questions, you will be subject to removal and or you will be blocked. It is okay to not agree 100% with the public health department, but we ask that you disagree respectfully. Now, let's get started. Dr. Joshi, if you could introduce yourself really quickly, and then Dr. Nimmi Rajapal.
Thank you so much, Deidre. To everyone out there who's watching, hope you all are staying safe and warm in the midst of the snowstorm. I'm Kiran Joshi. I'm a senior medical officer and co-lead at the Cook County Department of Public Health. Our health department is the health department for suburban Cook County, and as such, we have jurisdiction over a population of 2.4 million, over 700 square miles in suburban Cook County with 125 municipalities, a bunch of school districts, and so forth. And I want to acknowledge before I go into any further comments about COVID that this is Black History Month, and want to acknowledge the tremendous contributions made by African American people to this country, including, if I may say, to the COVID-19 vaccine development process. So there is a woman named Dr. Kizzmekia Corbett, who is a researcher with the National Institutes of Health, who played a crucial role in the development of the vaccine. And we really have her and many other scientists to thank for what I think is really a public health breakthrough of the vaccine. So with that, I'm going to turn it over to my friend and colleague, Dr. Nimmi Rajagopal. Thanks.
Hi, everyone. I'm Dr. Rajagopal. I am the Associate Chair of our Department of Family and Community Medicine. I am very strongly invested in getting our communities vaccinated. I myself have a 2-year-old who I am just waiting to get vaccinated, which makes this all the more worthwhile. The more questions we can answer, we want people to feel comfortable, and that's what we're here for. So just want to help you to understand any of the questions that we may be able to answer.
That's a good segue to get us started. We know that pretty soon that vaccinations will be ready for the younger age group. And so, Dr. Joshi, could you speak to that and what we can expect and what folks, I'm sure plenty of parents have questions and just want to know, is this something I should do? Is this safe for my young child? So can you talk a little bit about that as we kind of approach to that next phase within this pandemic?
Sure. So let me begin, and then I'd like to turn it over to my colleague for further comments. And it's that first, I want to say that the vaccines for COVID broadly are all safe. They're all effective. We know that all the vaccines at this point have been administered to millions of people. So we also have local data from our suburban Cook County jurisdiction demonstrating how effective the vaccines are. In fact, our most recent data, which includes data from the Omicron surge, is pretty clear in demonstrating that people who are vaccinated and boosted are many, many, many times less likely to have been hospitalized or to have died than their counterparts who are, I'm sorry, many times less likely to have been hospitalized or to have died than their counterparts who are unvaccinated. With respect to the pediatric vaccine, know that there is a very rigorous process that all vaccines go through. And essentially, they're de-escalated in terms of age. So we begin with older adults, adolescents, younger folks, and then our youngest and potentially our, some of our most vulnerable kids and infants. And the reason for that is because we want to be extra cautious and take extra measures in terms of safety when we are dealing with children. And I think that's, for good reason. So typically the way it works is that the FDA, the Federal Food and Drug Administration, will review all of the data from vaccine research, and they will make a decision about whether that vaccine should be authorized or, in this instance, undergo emergency use authorization, which is issued in the setting of an emergency like a pandemic. Once the Food and Drug Administration issues their opinion, then that moves on to the CDC, and a group of CDC scientists again reviews all the evidence, all the research, and provides healthcare providers with clinical guidance on exactly how and when a particular vaccine should be administered. So it's roughly like a two-step process. First, the FDA reviews and approves, and then the CDC provides additional guidance. So again, this is a really rigorous process to ensure that all vaccines are safe and effective. So for more specifics on the pediatric vaccine, again, I'm going to hand it over to my colleague, Dr. Rajagopal.
Deidre, were you going to say something?
Yeah, I was going to ask, because I'm sure a lot of parents are out here, and you said you were a parent yourself. Can you speak a little bit about that in terms of, one, when will it be available? And then, what advice or information would you give for parents that might not be sure or, just have some questions about getting their younger kids vaccinated? And we all, if you haven't taken kids to get vaccinated, it's not always a fun trip. So what might you say to those parents?
Right. Those are great points. And I think that's exactly why I wanted to be here, is that as a parent, every time I take my kid to get a shot, it's a little bit nerve wracking, right? Like, we're always worried because that's our job, is to take care of them. So, am I a little nervous when I get him shots? Sure. But am I a lot more afraid of COVID? Absolutely. And I think, to Dr. Joshi's point, the thing that parents really need to understand is there were no shortcuts. I know thinking about something that's called an emergency authorization is a little more scary, but there weren't shortcuts in the vaccine itself. And we're not putting something out there that we haven't had studied. It's going through a rigorous process. Um, so there's some reassurance there. And what we know is that with Omicron in particular, there's been an increased number of kids that have been very sick and hospitalized. And so we cannot take this lightly. And this is our best defense to help protect our kids. In terms of when it's coming out, what we do know is that the FDA is meeting to review this on February 15th. And so this, could be, later this month, that it's actually available for kids from 6 months old to 5 years old. To 5 is the new group, and then the others have already been able to get vaccinated. So we know right now that there'll be 2 vaccines for this primary series, and there may be a third one added down the line, because some of those studies over time to see how long the immunity lasts are still being done. And just like we had the booster added for adults and for 12 and up now, we may have additional doses that need to be added for kids as well. And that's just because we are assessing. There are hundreds and hundreds and hundreds of people assessing all of this and what's happening with COVID. And there's so much that's still unpredictable about COVID. But what we do know is that vaccines work and vaccines have a huge impact on what it means if someone gets COVID. So if somebody is fully vaccinated and gets COVID, it's much milder. And that can be a huge, huge difference.
What do you say to people that would say that kids, they are, it's not going to affect them as bad, so then why should I bother to get them vaccinated? That's something that I often hear a lot. So if it's not going to affect them really badly, what's the point? Any thoughts? What are you guys' thoughts on that?
Sure. So this is the thing about COVID is there's so many unknowns with COVID. And when we talk about, some people may have seen or heard about these long haul symptoms, we talk about those long haul symptoms starting after a month, which means that just with the acute initial infection, somebody can have symptoms of COVID up to a month. And what we can't predict is necessarily who's going to have that. We know that there are some risk factors that make someone more susceptible to having long haul symptoms or more severe illness, but we can't predict that a child is going to get it and it's going to be a mild case.
So we don't
Yes,
really know.
many. Right, we
We
don't.
don't
And
know.
there's just so much we don't know about COVID, right? Like you're constantly hearing about variants and subvariants that are coming. So again, the only thing we do know is that when we look at the numbers, the people that are vaccinated are the ones that if they get COVID, they're getting a much milder case of COVID. The people that are in the hospital are primarily the people that are not vaccinated. The people that have severe disease are primarily the people that are not vaccinated. That's the one sure thing we know about COVID.
So we have a question from Jake Griffin. What kinds of residual effects from COVID-19 are we seeing most commonly in hospitalized patients? What kind of strain is this follow-up care placing on the healthcare system? Either of you want to take that question?
Again, maybe I can start and then I'll hand it over to Dr. Rajagopal. In terms of this, I'll start with maybe the strain on the hospital system. I mean, I think this is the very issue with COVID, in that people, when they become really, really ill, they have to be hospitalized. And in a way, if those people are not vaccinated, that is a hospitalization that could have been avoided. And when those hospitalizations pile up, when there are a lot of people being admitted to a hospital at the same time, what that could mean is that the systems are strained and that people who have other illnesses are maybe not as are maybe not going to be seen as quickly. Sometimes what we've seen is that providers from other parts of healthcare systems are pulled in, nurses, medical assistants, and sometimes physicians too, to care for those extremely ill hospitalized patients. And that can mean that, later on down the line, it's increasing those wait times for patients who aren't as ill, who maybe just require an outpatient visit. Now, fortunately, in our state and region, we have a robust healthcare system with lots of capacity. And we haven't seen those images of healthcare systems being completely overwhelmed in the way that we have in other countries and in other cities in the US. But I think we can all agree that that's something that we certainly would want to avoid and prevent. And I think the vaccines combined with all the other measures that we've been talking about for many months now can really help us do that. So just with respect to the issues around addressing long haul COVID in the outpatient setting or the clinic setting, again, I defer that to my colleague, Dr. Rajagopal.
Yeah, it's I'd say the number one thing that I hear from patients is this fatigue. Just after they've had COVID, even mild cases of COVID, that it takes a really long time for them to recover and feel like they're back to normal. So, people that have had the flu before know that you get that fatigue afterwards, but we're talking about people that are coming weeks after and still just feeling like they're not quite back to normal. We have people with severe residual effects, so people who have had some damage to their lungs, heart problems, so a lot of shortness of breath and fatigue that's coming on. And then there's people that are complaining of this kind of mental fog that kind of lingers on for a while after. So those are just some of the common things that we're seeing. There's a myriad of things that can happen, and particularly in children, we worry about a multi-system inflammatory reaction that can happen with COVID. And again, we can't predict which children that could happen with. So again, we just want to take the precautions. And as Dr. Joshi said, it's not just about the vaccine, but it's also about masking and distancing and really using common sense about what we're doing and what risks we take in this day and age.
We also know that it's been slow in terms of uptick for children in that 5 to 12 age range that currently are able to get vaccinated. And so, what do we think that it's going to be slow for this younger group? Because I think sometimes people kind of want to play the wait and see game. And so, how do we move people that might be in the kind of wait and see and to actually moving them toward actually going and getting their child or children vaccinated? And I'll just also add to that, I've also been hearing a lot about people feeling like this younger age group has kind of been left to the side because that affects daycares, it affects people going to work and things like that. So can either of you speak to that uh, a little bit about that, you know, how soon people should get it? Like you just said, February, it could be out by the end of this month, so what should people be thinking about and how should be doing that?
Good. So, I think in terms of how soon should get it is when it's approved, we, support people getting it, right? But I do think that there has to be a comfort level, right? So that's part of why we're doing this now. I know myself and my colleagues, so I'm family medicine, I see adults, children, everywhere. So I've been trying to be really proactive. If I know somebody has an infant or I know someone had a child, even before that, 5 and up was approved, we started the conversations. The vaccine is coming. We got you vaccinated. Let's start thinking about when it's going to be approved for your children to get vaccinated. And what we know is that some people are going to wait and see. But again, it goes back to really encouraging people to know that the studies were done and we have data about what the side effects and things are to expect and that it's safe for kids. And so we need people to feel comfortable. So we want them to start asking those questions, start looking into it now. But when it's approved, we'll be supporting that they should start as soon as possible.
Possible. That's great. That's what this conversation is for. It's about getting those questions answered. So we have a question now. What can you tell us about Evershield? Is it helpful for immunocompromised people?
Yeah. So I'll take that. Evishield is a monoclonal antibody, and it sort of falls between, maybe you could think of it as between a vaccine and a treatment, in that it's a preventive medicine and it's designed to be given to people who maybe can't be vaccinated. So there's a rare group of people who either have an allergy to a specific component of the vaccine, or maybe they have had an allergic reaction to a vaccine before. And for those people, or actually for people who are immunocompromised and maybe they've gotten a dose of vaccine and after conversations with their doctor, it seems that they just have not mounted the immune response that we would expect to see after having been vaccinated. Those groups of people are eligible for this medicine. And it's helpful because it confers protection to COVID, and it's a medicine that needs to be taken every 6 months. So definitely, if you fall into one of those categories or think you may, please, please, please talk to your healthcare provider, and they can arrange for you to potentially get this treatment. I want to say really specifically that all of these treatments are new. So we're doing everything we can to make sure that healthcare providers in our region are informed about all the treatment options. The treatments, including Evishield, people may have heard of Paxlovid, that's a pill that can be taken, along with some other medicines, can be used and can be helpful, but they're only helpful if you get them at the right time. So it's really important that providers are aware and know that a number of healthcare providers and pharmacies around the country, and specifically in our region, do stock those treatments. And healthcare providers can find where those treatments are located by either going to our website or doing a search for the HHS, Federal Health and Human Services Agency treatment finder or treatment portal, and we can put a link to that in the chat.
Okay. Another question from Katie Duransky. Is CCDPH compiling data on nationally infected and recovered individuals, their rate of reinfection compared to individuals who received a series of COVID vaccines only? If it is being compiled, what is the data showing?
Yeah, great question. So we often get questions about this idea of so-called natural immunity. And so first, let me begin by saying that in my mind, I don't know that there's such a term as natural immunity. Like, how is it natural to get sick from COVID and potentially go, to the ICU and, have to have a tube down your throat to help you breathe versus, getting a vaccine. So I'm not a huge fan of that term. Be that as it may, there's national data and research that shows that vaccination is indeed much more effective at preventing COVID than people who have previously been infected. That immunity does tend to wane over time. As I confess with vaccines as well, it does wane. But we know and believe that vaccination also confers a kind of immunity that's maybe it could be described as richer or wider. And so it could be more helpful for future variants. As to that specific question about whether CCDPH is compiling data on people who've been infected and recovered, to some degree, yes, we do have some of that data. The issue, of course, is that more and more and more people now, and I think this is a good thing, more and more people are doing tests at home. And when people do tests at home, those tests are not being reported to your state or local health department. So we do not have the full picture of that, as it were.
Next question, and then I'm going to go back to something that Dr. Joshi brought up about home tests, but I'll go to the next question first. What information do you have that is different from European countries who do not recommend this vaccine for healthy children? Do you look at their data? So in other words, do you look at data outside of the United States? Other countries approach this differently. They may have a different culture or what have you, but they may be approaching how they're dealing with COVID differently. So what do we do with that data? Or do we look at that data?
Dr. Rajagopal, do you want to take a stab at that?
Wow, I actually, you know what, Kiran, I think I have to give that back to the Department of Public Health there. I don't have a whole lot of knowledge about the other countries that may not be recommending it.
Yeah. I mean, I agree with you. I don't know that I look so specifically at countries that aren't recommending, but it's not to say that I'm not, or that we collectively as a health department and a profession aren't looking at data from other countries. To the contrary, we always are. In fact, there was some recent data from Israel, from the country of Israel, where they have begun administering a fourth dose of vaccine of Pfizer, I believe, and some positive data there. So we're always keeping an eye on that. But look, at the end of the day, we almost always follow the guidance and recommendations made by our national authorities, which are the FDA and the CDC. But thank you for your question.
Great. So, Dr. Joshi, you started to talk a little bit about home tests. And so we know that home tests are now becoming more available. People, have been able to do home tests, but then there's also been a lot of question about, you know, is a home test, is that a good enough test? Is that the right test? So have a couple of questions related to that. If I have symptoms of COVID but test negative, like I'm symptomatic but I test negative of a home test, am I free to resume normal activity? So I think this is just kind of getting into, I have symptoms but I test negative. Can I just keep going with life, or should I, hold off a couple of days and take another test? What should I do? So
Sure.
because, and we know schools send tests to kids sometimes, but how should we be looking at testing right now?
Sure.
Home tests.
Um, so yeah, great. So great question. A lot of confusion around testing, and I think for good reason. So for the tests that are out there for use by the general public right now, they generally fall into two categories. On the one hand, you have tests that are so-called PCR tests. And on the other hand, you've got antigen tests. And the PCR tests usually take time, usually like 24 hours or more turnaround time. Those are the gold standard at this time. They are the best at detecting COVID if it's there. The rapid tests, though, while they aren't as good at catching COVID if it's there, particularly if you don't have symptoms, look, they have the advantage of being rapid. And so they can be really helpful. They're most helpful in situations when you have symptoms. Not as good if you don't have symptoms or before you begin to have symptoms, which is why we say that if you've been exposed and you have a negative rapid antigen test, and by exposed, I mean if you've been, within 6 feet of someone who has COVID for more than 15 minutes, then you really want to be careful with that rapid antigen test. And I think that's particularly important if you're around other people who are vulnerable. You don't want to, potentially expose them. If you have a negative test in that kind of setting, best idea is to repeat that test. We found that serial testing in that setting is helpful, right? So negative test, I'd say repeat it, or you can get a PCR. If you have a PCR right off the bat, I think I'm a little bit more comfortable with that.
And how often should people, like, if they need to test, should they wait a couple of days? Should they, you know what I'm saying? Because people always, I think what I've often heard people say is like, well, I tested negative on this day, and should I wait a couple of days,
Yeah.
to see if I test again?
Yeah. Yeah, I mean, so what is it, like something like 3 to 5 days after exposure? The bottom line, though, is to repeat the test. So it could be a day, it could be 2 days. Again, it's just making sure that you're repeating the test so you get more than one data point, I guess. And again, it is helpful to get a PCR in that setting because those are a little bit better. Just a quick word about PCRs. And it's that it gets tricky with PCR tests because if you've had COVID and you get a PCR test after you've had COVID, those can remain positive sometimes for months and months. So just a note of caution with interpreting those.
Where can people might be interested to know, in terms of getting vaccinated, that might, I'm going to go back to that. They might be hesitant or whatever. Where can they get vaccinated? How can they find out where to get vaccinated in suburban Cook County? Because people say, where can I go?
So we have lots of places to get vaccinated. We have our My Shop page where people can look and see what's in their vicinity to get vaccinated. Cook County Health, all of our clinics, we can vaccinate, and we do have 3 mass vac sites that are open for a few more weeks. One in Matson, one in Forest Park, and one in Des Plaines. But I think the site is probably the best place to go and kind of look at what's in your vicinity, what's in your area as a possibility. I just want to make one quick point about the tests and just remind everyone that we're really focused on COVID, but it's still flu season. So if you have all these symptoms and you test negative, it doesn't necessarily mean that you can't get somebody sick, because you could have flu and you could get somebody sick still. So if you have symptoms, we still want to, maybe not go out to a party or go around a lot of people, or as Dr. Joshi mentioned, also if you have people that are at higher risk, really good to still think twice about going and visiting. Just we know we're focused on COVID, but it's not the only thing out there right now.
What can you tell us about stealth Omicron? Is it already in Illinois? Will it make case counts go up again? Either of you don't want to take that one.
Dr. Do you want to?
Go ahead, Dr.
So this is something that we've been following, and is definitely an instance in which we've been looking at the data from Europe. This is a variant, a subvariant of the Omicron variant that showed up in Denmark, I believe, a few weeks ago, and has been spreading really quickly. It's certainly more transmissible than the Omicron variant, the vanilla, I guess, version of the Omicron variant. And the sense is that it's most likely already here in the United States. And while I don't think there's any evidence that it's more dangerous, that is to say that it results in more severe health outcomes, we do think, and we are concerned, that because it's more transmissible, it could mean that the surge that we've just started to come out of could potentially be prolonged. So definitely cause for concern, but also cause, I think, for us to sort of all remain vigilant and to make sure that, once again, we follow that good public health guidance that we've been talking about from the very beginning, which includes, of course, getting vaccinated, getting boosted, masking, distancing, being careful with crowds, and really those common sense things that Dr. Rajagopal mentioned earlier.
So speaking of that, we know that the health department consistently puts out mitigations or orders. For those of you that might not know what mitigations are, things that we need to do in order to keep all of ourselves, safe. When can people want to know when will these things be lifted? Are we going to be? Do we expect that we're going to be wearing masks for the long term? I think people just kind of want to know, and I think you just said stay the course, but I think people kind of want to understand what that means, because I think people often have thought that, well, if we wear the mask and get vaccinated, it's going to go away, and things will just go back to normal. You keep hearing all types of people saying, "Let's get back to normal." Can you speak to that a little bit?
For sure. So first, let me say this is something that our agency takes really seriously, because we know what an impact it has on people. Our fundamental driving directive is to keep people safe, and particularly people that are vulnerable. And we think about that a lot in terms of people who are vulnerable from COVID, but we also know that imposing mitigations has like an economic impact that can impact people's lives. And we know that those economic impacts can also have impacts on people's health. So we are aware of that. We always want to take the least restrictive means that we possibly can. So as alluded by the question, we did impose a mitigation order about a month ago, essentially in line with an order issued by the city of Chicago, which required that people who patronize restaurants or any venue that serves food must show proof of vaccination before before being allowed to dine in that facility. The idea there is that you cannot eat, obviously, without removing your mask. And sometimes alcohol is involved at restaurants, and this can cause people to maybe be a little bit closer than they might be otherwise, to talk loudly, and to have fun, right? So unfortunately, had to impose that mitigation measure. We look at a number of different indicators when we're deciding what mitigations to issue. In particular, we look at things that tell us that people are getting really sick, that people are having really severe health outcomes from COVID. And the number of people, the rates of people being hospitalized, the availability of intensive care unit beds, these are all things that factor into the decision making. I want to be clear in that it's not necessarily one number or set of numbers. It's the whole, the picture as a whole that we try to look at. And we also try to ensure that we're in alignment with our colleagues at the City of Chicago so that there's one uniform approach throughout Cook County. We know that doing otherwise would be very confusing. So we're thrilled that the numbers are going down. By my reckoning, all the indicators are headed in the right direction. And know that we evaluate the indicators on a weekly basis and are certainly having ongoing conversations with the City of Chicago to come to a decision about when those mitigations would be lifted. I don't know that that's going to be this week or the next. I think we need to see a few more weeks of sustained improvement in the indicators. Again, given my earlier comments about the BA.2 subvariant. But please, again, know that we're looking at this very closely. We completely understand that this affects many people's lives. And as soon as we believe that it's safe to lift these measures, we will certainly do so.
So we need to stay the course for a little while longer then.
Yes.
So Dr. Rajagopal, will we have to take another booster? Do we see another booster having to happen? Do we know that yet? Will this be like the flu where we have to take it every year? I think those are questions that people want to know as we move into, people getting their second dose. People want to know, am I going to have to do this again? Am I okay? Do I have to sit and wait? What's going to happen?
I think it's a great question, and I think it's good for people to be thinking ahead. I think that yes, there will be some long-term plan for this, that we're doing it on a regular basis, similar to the flu. In that the reason we do that for the flu is because it can we get variants, right? And so we want to boost ourselves and protect ourselves. So that's exactly what the booster does. Is it just beefs up our immunity a little more so that we can fight off the infection if we're exposed to it. So it's very likely that there'll be another booster, or that we'll have a regular schedule of every 6 months or every year that we're getting the shot, similar to the flu shot. We don't have that timeline laid out exactly at this point, because again, there's just so much that we're still figuring out, the variants and the subvariants that are popping up. But this is where these long-term studies. So remember too, when we all got vaccinated, there was the program to report any side effects and things that you're having, because this is all a fine balance to figure out how often do we get boosted and still keep everyone safe and healthy, and how realistic is this. So yes, I anticipate there will be boosters ongoing, or an annual COVID shot similar to an annual flu shot. But I think we're still in those early phases where we're trying to figure out exactly how often it will be.
Okay. So how is Cook County trying to get, we have a question from Jordan Asquith. How's Cook County trying to get more school children vaccinated in order to keep schools open for everyone?
Thank you for that question. Deidre, I almost feel like this is a question
I kind of feel like that was a setup. Sure. Well, we do, as the health department, we have a weekly call, every Friday with school officials to keep them updated about COVID. We also urge them to host vaccination clinics at their school, where we will send out providers that can provide vaccine. We also let them know about any other vaccination sites that are popping up in their communities. We have a variety of community-based organizations that we work with that host vaccination events. They partner with schools. Sometimes schools partner with them as well. So we're always keeping schools abreast in terms of their leadership. If we're sharing information that they can share with their parents about vaccines, we'll be doing the same thing if uh, a vaccine comes out for the youngest of children. So we are in constant partnership with all of our schools in suburban Cook County in order to keep them abreast around COVID-19. And they've been a great partner, and we've been meeting with them literally every week since the beginning of COVID. So every week we're meeting with them because things are changing, more questions come up, mitigations come up. So we know that there are always more questions about what they should be doing and how they can keep their schools safe. And our goal is to help them to keep them safe. Next question I have is about masks. I want to talk a little bit about masks because, as you know, people now, everybody's wearing, we've gotten people to wear masks. Many people have fancy masks. They have masks that they designed themselves. They have homemade masks. They have 2022 masks. You can get a mask pretty much saying any statement that you want. And so we're hearing a lot now about KN95 and N95s and what's the best mask. So my question to you is, should we be throwing our cloth masks away? What should we be doing as it relates to masks right now? Either of you can take it.
So I don't think we want people to throw their cloth masks away, but it's a good idea to layer, right? So they could use a cloth mask and use a surgical mask. So what we're finding out is, Omicron woke us up to a few things, and that it was much more easily transmissible than the previous variants. So a little extra protection is good. The key, though, is um, we need people to mask, so and keep the mask on. So if an N95 is just too much and you're not going to wear it, then layer with the surgical mask and a cloth mask. Um, every protection counts. So the N95s, that's what we wear when we're in clinic, when we're working, when we're seeing patients. They have to have a good seal. You have to test the seal, and the key is to know that if you put your hands around your mask and you blow out and you feel the air coming up, then that's not protecting you as well as you'd like to be protected. So don't throw the cloth mask out, but layer it and give yourself some added protection. And then, of course, if you are using a KN95 or an N95, it's a good idea to go to the CDC and make sure the ones that you're getting are legitimate ones. They've said the KN95s that up to 60-70% can actually be counterfeit, but there are some really good brands out there that have been found to be reliable, that have been approved under the emergency use authorization by the FDA. So if people are buying those, it's a really good idea to check those resources as well when they're buying them.
Often people are concerned when it comes to masks, to your point about the counterfeit masks. So you're saying CDC lays out which ones are the real deal and not the counterfeit.
Yeah, and so honestly, there are a lot of outlets out there that have done the research for you. So if you actually Google it and you look at, there's some articles from New York Times, USA Today, that actually went, and they actually have the links in the articles that will take you to the CDC to confer that that's one of the ones that has already gotten the FDA EUA approval. So they're easy to check out, and so before people are buying, it's a good idea to check out which ones they're looking at and considering buying.
Another question I have here is, the recommendations, just like mitigation orders, continue to change. And I think people want to understand a little bit, why is that? Because oftentimes, because things change, people say, well, then it must not be true, or they don't know what to say. You see all types of media about how we change. It was 10 days, it's 5 days, it's wear a mask, it's not wear a mask, it's wear a KN95. So can you speak a little bit to sort of how things have continued to change and may change, and how people need to look at that? Because oftentimes people view that in more of a cynical way than the fact that the information that we have changes. So if either of you could speak to that, that would be great. We get that a lot.
Um, so first, I guess I'd say for those of you who think that the guidance from public health and different health authorities has been confusing, I completely understand. It has changed. Sometimes there are like nuances in there that are hard to communicate. But know that what we're trying to do at the end of the day is to get it right. And maybe there are times that we don't get it right the first time. We will always try to communicate more clearly the next time. And I'm speaking for myself when it comes to that. So some of it is that. Some of it is that it is the nature of science that we explore and we try to determine what the best way to proceed is. We try to do that. We see if it works, and then we course correct. So it's a constant process where we're building on what we learned previously. And I think that's always been the case with science, only the changes happen over the course of years. And so public health and health authorities have time to develop messages and communicate and have those messages sink in and have others carry forward those same messages. With COVID, all of that has been accelerated, right? Because the virus changed, it came on so quickly, the pandemic came on so quickly, and it changes so quickly, right? So I'll be very honest in that we too, it takes us time to absorb some of the information that's coming in and digest it and then try to communicate it out to the public. So I just want to end by saying thank you for your patience, everyone. We're doing our best. Thank you for hanging with us. We really appreciate it.
And Dr. Rajagopal, if you had one message to give people, in general about just the pandemic and where we are and COVID and all of that, what would you have to say to them? What would be your advice or input that you would want to give?
Well, I think we know everybody has to make their own decision, and what we're here to do is get as much information out there as we can and help to encourage people to make the decisions that we think are best based on science and the studies and things. But we know that it's very confusing and there's a lot more at stake than it's not as easy as just going to get a vaccine, right? We've been in this for 2 years now. People are exhausted. People are emotionally exhausted. People want to be able to just hang out with their friends. But we're in this for the long haul, right? So 2 years, masks, all of this is frustrating. But if it means keeping your family safe, if it means that we're all here in a year from now, we have a new norm and we can go out and do the things that we used to and not have to worry so much. It's hard, but persevere. And then this is the whole reason we have these Ask the Doctor questions, because these sessions, because there are so many questions. So rather than take what your neighbor or the cab driver or the mail person say is their interpretation, come talk to us, and we'll help you to understand the science. As Dr. Joshi said, this is all happening so fast. It's happening so fast for us too. And it's all happening out in the open eye right now, right? Like, as he said, usually these scientific discoveries are coming over time and they go through, everything's vetted before it's opened up to the public, but everything's happening in front of everyone right now. And there's so much to process. So really just talk to providers, talk to your pharmacists, talk to the people that can help you to figure out these things, and get help when you need it, really, on all levels, right? If there's a whole nother mental health component here that we haven't, we talk about a lot, but there's so many things to talk about. But we're not just here to say get vaccinated. We're also here when you're dealing with the family member that's in the ICU and you're not understanding what's going on. We're here to advocate for you. That's what our job is, and that's why we're doing this. I'm so fortunate that from the experience with CCDPH, I have a small mobile team that's going out to churches and to schools. I mean, they did 350 vaccines at a middle school, last weekend, and but they're out there and they're talking to people. So that's why we're getting out into the communities. That's why we're there, because we want to answer questions and we want people to feel comfortable, not just do it because we said go get vaccinated.
Thank you so much. So I want to thank Dr. Joshi and Dr. Rajagopal for this great discussion. I think it's important to get people where they are, meet them where they are, to address their concerns and to get their questions answered so that they can make an informed decision with regards to COVID. You brought up an excellent point at the end about mental health, and we need to make sure also that we are, taking care of all sides of our health, in terms of vaccinations, but also making sure, that our mental health is okay, because many of us have been cooped up somewhat for the last 2 years, or really just haven't been able to do our normal. And we're here really to answer your questions. We're here to give you information and to get that information out to you and get that information to community. So we want to thank you both for joining us for Ask the Doctor tonight. And we hope that we were able to answer questions for those of you out there that might be feeling hesitant or just needing to know about some of the things that you may be hearing in your community. So we just want to thank all of you for coming out and participating in our Ask the Doctor series. And until next time, bye.